quite heavy air is required here, especially on a person because of the saliva content. Okay, and same thing on the lingual. Okay, that's looking quite good. Okay, if I need to do that some more, I certainly will. I'm going to assess it with a mirror. Yeah, and it looks great. If there was an area that wasn't cooperating with the air, I would then introduce the flat plastic instrument. Okay, and you need to use direct vision here because you need your non-dominant hand to retract. Again, out to the buccal. Fulcruming with your right hand or dominant hand. Pull the dental dam out a little bit, just straight out, and that you did with the ligature. But basically you're going to try to get the PFI under the open area, let the dam go slowly. You're on the distal, you rotate to the mesial. And that's your technique of how you invert with PFI. We want to avoid the kind of, I always say, boinging it into the dental dam, because that will cause miniature little openings and tears and pinhole tears in your dental dam, causing exposure, moisture control as well. Okay, so I'm happy with the inversion. Okay, so I'm ensuring there's no tears, trying to be sure of that. And then I'm going to finalize this placement by stretching and securely attaching the dental dam to the frame, ensuring all prongs are attached to the dental dam. Have it again similar to what a bed sheet would look like. Okay. And I also want to go back to these jaws of the clamp. Okay, and ensure they're around there properly. Do my finger. Okay, and that is your application of a dental dam from tooth number 2.7 to 2.1. Upon completion of the restorative procedure, and it's time to remove your dental dam, you most likely will need to do a rinse of that area to ensure all debris is removed. You want a clean dental dam, meaning no amalgam fragments or debris on the dental dam prior to removal. So with your dominant hand on, or your dominant hand, non-dominant, you'll have the HVE. Okay, turn on your HVE and just begin rinsing with the air water spray in that area, or even just water is fine sometimes depending on the situation. Here's the water spray. Okay, get the excess. You may want to ensure that the client is not gathering a lot of saliva underneath. If you need to slip the saliva ejector underneath the dental dam, you may prior to removal as well. Okay, so everything's cleaned up nicely. We're going to go ahead and remove, beginning with the removal of the ligature. Okay, so we would use the hand scaler for this, using direct. As a reminder, your ligature is this knot on the 2.1 facial that you placed. Okay, so just retract the dental dam with your finger. You can see the knot. You can also see the tissue, which is important because you want to avoid touching the tissue with this scaler. The point of your scaler has to be away from the gingiva. So the point here is towards the incisal, and that's exactly what you want. Okay. Get the scaler around that knot, and it will typically cut, and you can see I have a nice strong fulcrum, and there it cut. Okay. I retrieve my cotton pliers, try to remove it that way. Okay. Sometimes the easiest way would be just to pull it out with your finger, and that did work well in that situation, so that's completely fine to do that as well. Okay, we now need to cut the down septa from the buccal with your scissors. Okay, so please have your client turn towards you at this point. Just going to adjust a little bit because you need to use direct vision here. So we begin with your non-dominant hand retracting with one finger, your index finger under the dental dam. Can you see mine wiggling right there? Okay, and your thumb on the outside portion. Okay, so we just want it to retract it enough where you can get your scissors underneath the entire septa, like so. Once you're there, you can go ahead and cut. Okay, and you do that similarly, moving down tooth to tooth. We like that scissors to stay parallel to the tooth. Okay, we don't want you going in like this because you have chance of rubbing against the gingiva. Good. And that last one, if I can cut it with this, and I think I can, I'm going to. Okay, if not, if you have a situation where you just cannot get the entire thing, you would go back to using your scaler with the point away from the gingiva. I'll try and move my hand so you can see. There we go. So I have the point around the entire septa and cut. That's snipped quite easily. Okay, so the buccal is cut. We need to loosen it from the lingual. Okay, just to ensure the removal is nice and smooth. Don't want it cut or caught. If it's caught, you will have to go try to dig out that missing piece. We're going to then remove the frame, dam, and clamp as one unit. It can come off separately. However you like to do it is fine. I think typically it would come off as one unit. You're going to use your mirror for indirect vision so you can line up your holes. I'm using my forceps, dental dam forceps, to put the beaks into the holes of the clamp. Sorry again, there's no way around trying to get you to see this a little bit better, but I'm removing it. You could just let your clamp go at this point because, as you know, the floss is attached to the frame. So there's no chance of it falling or going behind and aspirating the client. Okay, if it's at this point where it's dangling there, you can use both hands to nicely control the removal. Okay, and you just wiggle it, and you're going to move this to the tray troll. Tend to your client. They may want a tissue at this point, but as I definitely give them a nice full mouth rinse so that they're feeling nice and fresh. So I'm going to start with the area probably most likely that we were working on. Sometimes they may need their tongue sprayed nicely and the roof of their mouth just to get it all nice and fresh. Comfort at all times because they are the important factors in this. Okay, once that's removed, you're going to remove your clamp, your dental dam from your frame. Lay it on a flat surface. I usually use my tray troll, but for the sake of the video, I'll use the palm of my hand. And you are trying to assess if the cut was nice and even, that your holes line up nicely. If there was a tear, you would see it. And if there was a tear, you would know that there's a piece you need to retrieve. Okay. Even when there is no tear, you would always go in and view the oral cavity and ensure there's no missing pieces. If there was a missing piece, they could get removed with a piece of floss, a cotton pliers, or even an explorer if need be. How are you doing, Henry? Are you doing okay? Are you feeling all right? Okay. And that is the conclusion of the demonstration of how to apply and remove a dental dam on the upper left quadrant from tooth number 2-1 to 2-7.